Hi everybody, I'm here to talk to you about my IUD and the removal of such IUD. My IUD was embedded in my uterine wall for about a month or so because it took so long for my primary doctor to refer me to this other OBGYN to get it removed at the OR because of it being embedded. It didn't go exactly as planned. I had my follow-up with this doctor who I loved from the moment that I met him. He's very upbeat and he kind of was a no crap kind of doctor. He got right into business and didn't care about hurting anybody's feelings. He just said what he had to say and pretty much decided on the plan that was going to happen. At this point, I had been waiting for almost 4 weeks for this, and I had a baptism that was scheduled for October 28th. So, there was really nothing that I had already waited this long, so I could have waited a little longer. And that was the plan, to go and do surgery because I do have other issues going on that I think were exacerbated by the IUD. Even though it was a copper IUD, there was no hormones or anything, but I do feel like when they inserted the IUD and they had to actually hold on to my cervix and change the position so that the IUD could go in, kind of set a set of events that happened after, because sorry, I've had this other issues going on for years and they weren't a problem until they became a problem. Now, I don't want to blame the IUD completely because the chances of my other issues becoming an emergency were already pretty high. I just feel that the IUD being not inserted the correct way was the precipitating factor to things getting kind of out of proportion and having to be dealt with right away. So I did not schedule a hysteroscopy. It happened as an emergency, as I was saying. The emergency wasn't the IUD removal, but obviously if I was gonna go under, then they might as well go ahead and take it out, which they did. The strings were still visible from the outside, which they hadn't moved. The IUD moved, obviously, but not that much. So they removed it. There was barely any bleeding per the OR note. They obviously inserted the camera to look at the structures. Everything looked okay. Not perfect, obviously, but otherwise unremarkable. And it didn't seem like the IUD had made a lot of damage to my uterus. So he got out. IUD was out. Seemed to be in one piece and was sent to pathology just so that they can make sure that everything that is supposed to come out did come out and there's not a piece left in me. Then I will tell my story in another video about how I ended up having emergency surgery. Obviously, it has all to do with my reproductive system, and I had kind of touched on it on my last video and talked about how I have cysts, and this would be my third surgery to remove a large ovarian cyst. But pretty much I was bleeding internally from my ovary due to the torsion that happened with my cyst because it was so big. And like I said, I think it's a little related to the IUD because of the way my uterus was positioned. They had to adjust and do all kinds of maneuvers to safely put it in, which we all know they didn't. But and my right ovary had adhesions. It was I just had a follow-up a week post-op, So this all happened on October 20th, which was a Saturday. Uh, but there was so much going on that the you just can't discuss and clarify everything in one visit. So the main purpose of my post-op was to look at my incision, and I read the post-op, the notes and everything. But so technically, I ended up at the ER with symptoms of possible bleed, or why is this trying to focus? Of a possible bleed, and my doctor, who happened to be at the hospital, which I was lucky, so I didn't have to wait until the ER ran all kinds of stuff to figure out what was happening to me. He thought that the large ovarian cyst had ruptured, and that was why I had some symptoms of shock. So he thought at this point he was going to do the hysteroscopy, get the IUD out, and then do the rest of the surgery laparoscopically, which is when they do the 3 little incisions and go in through your belly button and look at things, and then they make 2 other incisions for their instruments, and they perform the surgery that way. I've had that type of surgery many times, and the recovery is pretty awesome compared to major surgery, which, when you have 2 C-sections, that's major surgery. They cut through various layers of your abdomen, and as we find out, we need those muscles for everything. But anyway, at that point, he puts the camera in. That's the first thing that they put through your belly button. And he notices that my belly is full of blood, and the cyst is still there. And there's a bunch of adhesions on my right ovary that has attached, not sure to what. He didn't tell me, it's not on the OR note, but it had so many adhesions that the ultrasound that I had done before thought they were complex cysts of sizes like 5 centimeters, 4 centimeters, and another one like 2 centimeters. So there was quite a bit of scar tissue and adhesions on the right side. So at that point, he had to figure out the bleeding and all kinds of other things, and this cyst was looking a little suspicious to him. So at that point, he opened me up. And like a C-section scar right under your belly from about the size of a hand, like not good with inches, but just a regular C-section scar or opening would be what they did. At that point, they did see a hole in my uterus. So the IUD obviously can't say for sure, but it is on the report that he believes the IUD had made it through up to the outside, like one of the arms of the IUD had made it to the outside, which kind of makes a little sense since I was bleeding internally and I thought I had my period. It was about a week earlier. It wasn't so early what I would think it wasn't a period. The cramping was almost like the same kind of cramping that I had when the IUD was inserted. So maybe it was pain from having it go through the tissue, because that's what happened when it was inserted, and that's what happened this time around, where it actually made it almost one side made it out. And I believe that's the bleeding I was seeing when I was going to the bathroom. Wasn't my period, but the pressure from the blood in my abdomen, it kind of slowly leaked into my uterus. And then when I sat down in the toilet, this whole gush of blood would come out. But it wasn't enough for me to worry, because obviously we expect heavier periods. We expect more cramping. So it wasn't I wasn't alarmed at first. Uh, so there'll be a whole nother video when I feel better. I am about a week and a half post-op. I actually feel pretty good. I had so much pain waking up from surgery. I'll do a whole history and story about how I ended up having emergency surgery and what got me there and why. But I wanted to do an update on the IUD. So right now I have no IUD. I do have a big incision, not related to that. I don't know if to be grateful for the IUD, or like I said, if the IUD was what precipitated the other stuff. Because if I didn't have the IUD like that, I wouldn't have gone to this other doctor that seemed to know what he was doing instead of the OB that goes to my family practice. Ooh, he was OBGYN. So on certain days, there was an OBGYN on my family practice, and that's the one I went to. So it's not like I had my primary doing this. It was a resident with his attending, but you would think an attending would have a lot of experience and would have known what was happening. I am very glad that that attending didn't feel comfortable with doing my surgery, because that's how I ended up with this other doctor. I did hit my head quite a bit, and my nose hurts quite a bit, and I don't know. I'm like, do I even get the regular symptoms of everything else? Because sometimes I wonder if I have a tiny hairline fracture on my nose, because it looks a little to the side, but you know, it doesn't hurt that much. It does hurt, but I did bang my head. I had a bruise over here. I had a busted lip from hitting my face. So I think I hit everything. I'm not sure if I hit the wall, the door frame, or if I went face first, because what I remember is sitting when I am waking up, and my husband was trying to talk to me. But anyway, I'm not sure if I should be grateful, because I thought I was bleeding because of the IUD, which the doctor says no, it was my ovary that was bleeding with a cyst. God knows how long it has been, but probably not long, because blood doesn't belong in your abdominal cavity. So you start feeling bloated, you start feeling burning. As a nurse, I started looking for bruises at first. When I was like the second day, the bleeding didn't look normal, and I knew I had all these issues. I was worried that the IUD had made it through my uterus, because the pain was getting so bad. But I didn't have the telltale signs of internal bleeding. I had no bruising. My abdomen was still pretty fluffy, you know. I still was able to do everything that I wanted to do. The day before I actually went to the hospital, that's when I started to really worry about it, because I was starting to feel the burning on my abdomen. But like I said, still, it wasn't hard. There was no bruising. There was no, from the blood that was accumulating, that would make, come to the surface and appear as a bruise. There was none of that. There was, I have a very high pain tolerance, and sometimes that can be scary. I'm actually scared for my next period, because it's a little traumatic what happened and the way that I remember it. I hate surgery. At some point, I have the fact that I just went and had it done within a half hour certainly helped me not have as much anxiety, pre-op, but not really sure I wanted it to happen that way anyway. But the doctor was there. Everything went well. They sent the cyst and the IUD to pathology. I stopped bleeding immediately, even though sometimes after any type of surgery down there, you have bleeding. I didn't bleed at all. Just a little discharge like you would have at the end of your period. The incision is healing pretty nicely. No cramps, no nothing. I had no cramps or anything like that. All my pain when I woke up from the surgery obviously was my incision. I am glad that everything turned out okay. I don't recommend the IUD. You know, it's up to you to search it up and figure it out. The older you are, the more chances that you do have some other things going on in your body, where I think they don't do enough looking into, you know, anatomy and all kinds of things. It seems like a routine thing, but as you get older, as you are obese like I am, then things are just not as expected. Like I said, so I wanted to lose weight, so I'll do a little tiny video after this to talk about that and what restrictions I have now post-surgery. All right, thank you guys, and I hope that I gave you some information about the IUD and my story, because this is my story. It's what happened to me. One of my kids gave me that little doggy bear after my surgery because it reminded them of my little girl over here. And they knew that I would be missing her because I had to spend a few nights at the hospital post my surgery. So that was very nice of them. Didi, say hi. This miss has been licking her wounds, so we had to put a cone on her, and she loves her mama very much, even though she's giving me her back right now. This is the window, so she's like, this is her favorite spot to look and bark at everything that comes by. This is the second time I make this video because I don't know how to do anything like editing or anything like that. So she ruined it the first time. I'm sorry I ramble so much. I'm sorry about my accent. I'm sorry about many things. I hope you got the main point. And I'll see you in the next video. If you want some time.